Hi, everybody. I'll go ahead. We're just pulling up some slides here, but I wanted to say welcome to everybody. This is very exciting. How many people are here for the inaugural LGMD2I conference? Just pretty amazing how one phone call to this wonderful woman right here. We were at the Iowa conference 2 summers ago, which those of us in the US know as sort of our home away from home for our LGMD2I community. Thanks to Dr. Matthews and her amazing team over there. And I met the Davidge family when I was there 2 summers ago, and I said, oh, I can't wait to see you again next year in Iowa. And they were like, we can't come back again. It's so far away. And I said, well, certainly you have something like this over here in Europe. And they said no. And so I emailed Lindsay and her team over here, and all of a sudden, less than 2 years later, we are here. So I would be remiss if I don't start off by saying thank you to this amazing team here at Newcastle and all of the experts in the room who have flown here and came here to make this happen. So on behalf of our LGMD2I community, we are all really excited. And I think having this community connection is sort of that emotional and mental health impact is such a big difference maker. It's where I met Kat Bryant in Iowa, who is basically, you heard from her this morning. She stepped in when I was not here. But we work together all the time, her as a 2I patient and myself as a 2I mom. And so I'm going to head and start my story very briefly. This is my daughter, Sammy. She's now 16, but she was around 2 when she was diagnosed with 2I. And at the time, we were told, well, you know, good luck. You can try some steroids, but we really don't have anything for you to help her just keep her healthy. And I'm like, well, what does that mean, right? And so when I was at the NIH, Dr. Bonneman's team said to me, well, if you really want to make a difference, start a foundation because there's not enough research for a treatment for this disease. So that was my prescription pad that was given to me. And if any other caregivers are in this room, you know, you'll do what it takes, right? You want to do whatever you can to help your loved one. And so that's what we did. And these are sort of our 3 pillars of our foundation. Our first priority is advocacy. We work together with other patient organizations, in FDA meetings, and of course with our industry partners. We serve on advocacy boards to try to bring the voice of the patient to drug developers, to the FDA in the US, and working together with other patient communities to make sure our voice is heard. We like to spread awareness. We work with the LGMD Awareness Foundation and try to be at as many meetings and conferences and spread word through social media campaigns and things like that. And we started off from day one for advancing science, and we have tried to support as much research development, investing in startup biotech companies, and we're going to continue to do that until we have something approved. So we're getting closer, guys. We're getting there. One of our biggest events that we do of the year started off as our family's casino night. We would have a game night to invite our local friends and family, and it thankfully has expanded to a multi-site event. It's a hybrid event, and hopefully you can join us online on September 28th. We like to celebrate it around LGMD Awareness Day, which is always on September 30th. We work closely with them, and so we are going to have it the Saturday before for the virtual event. So if you can join us, that would be great. And we will actually be, some of you might see yourselves, so thank you for being here. We have a filming crew, and the Davidge family has volunteered to sort of share their story, which we'll get a little more detail about that. But we will have a documentary shown that night, and it is sponsored by ML Biosolutions, and so we're really excited to see how that turns out. So we've been able, thankfully, for the generosity of our donors, we've been able to contribute about $1.2 million in research and conferences like this. So this is my favorite slide, just to see how many people are interested in such a rare disease that we do have so many amazing, brilliant scientists that are continuing to work and progress toward a cure for us in our community. And I want to thank the LGMD2I Research Fund, who is Jean-Pierre back in the corner, is my go-to guy. And I say, JP, can you read this and tell me what this means in caregiver layman's terms? And he does an awesome job with that. I already mentioned Kat, who I work with at the Speak Foundation, and Carol Abraham, who would have loved to have been here, but she started the LGMD Awareness Foundation. And there's an advocacy table back in one of the breakout session rooms if you haven't been back there yet. There's lots of goodies. LGMD Cab, who's here, Alexandra, I know she has some things back there. So go take a look and grab some goodies if you can. And get connected with us. That's a QR code to our website. We try to keep up to date on all of our social media pages with research updates, ways for you to get involved, and try to make this, make connections with patients. We have about 2,000 people, I think, in our LGMD2I Facebook group. And I joke around, I say sometimes that's like our, Facebook MD for LGMD2I. We share so many life hacks and, successes and failures, all the above, but it's a way to kind of bridge the gap between feeling disconnected. If you don't know somebody in your hometown, most of us probably don't know somebody close by that has this condition, but it's a way to kind of, get closer. And I have to say, get registered if you haven't already, of course. I can't let that go. It is a way to get counted. It's a way to really show how many patients we have. And when scientists are looking to study a new disease, having a registry is really important because that's where they can get some of the data that they need. And again, just thank you to all the patient orgs that were able to help put this together and collaborate all the efforts to make this possible. We are, even though our countries are all spread apart and our orgs are all over the map, we really can come together and work and make something like this possible. So thank you for being here. I wanted to help get caught up on time. If you have any questions, I'll be around, and I look forward to getting to know some more of you on a personal level. So thank you.